Thank you so much for coming today. I typically do presentations on the communities of practice calls regarding general plans, and one of the presentations I did before was on the housing element, and that was in there was a lot of demand for the recording of that element, and so just through gauging participants on the general plans communities of practice call, but also smoke-free multi-unit housing communities of practice call, I decided to go into a bit more detail with more time and more discussion for the housing element through just PHLC. So I'm at the Public Health Law Center, and the Public Health Law Center is located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. We acknowledge that we are in the indigenous homelands of the Dakota people, also known as the Sioux Nation, and that 4 federally recognized Dakota tribal nations remain in the area. The region is also shared territory with the Anishinaabe, also known as the Ojibwe or Chippewa, and the Ho-Chunk Nation also has historic relationship to this region. We appreciate the ongoing stewardship, spiritual connections, and lifeways developed in these homelands upon which the law school sits. Relatedly, I want to acknowledge the difference between traditional and commercial tobacco. Throughout this presentation, I will refer to the environmental impacts of tobacco, but I want to clarify. I am talking specifically about industrial scale commercial tobacco products. I am not talking about traditional tobacco as it is still used religiously, medicinally, and ceremoniously in many different cultures. The Public Health Law Center offers free legal technical assistance to communities, public health advocates, and other partners. We also publish on important issues pertaining to commercial tobacco control, and we offer trainings and webinars. We do not offer direct legal representation, and nor do we lobby. So all of our work at the Public Health Law Center is grounded in health equity. This means working diligently to ensure that everyone has access to systems that promote healthy lifestyles. We are committed to removing all institutional barriers and applying an equity lens to our work to produce the best results for the communities that we serve. The social determinants of health inform our work at PHLC as well. This means acknowledging that there are several factors that influence public health, including structural and systemic racism, political determinants of health, housing, environment, and a variety of other social determinants. In the context of the discussion today, we want to make sure that we're creating policy with social determinants of health in mind. Policy should seek to balance the goal of protecting the public from second and third-hand smoke exposure, as well as tobacco product waste, with the knowledge that punitive measures are unlikely to help those struggling with commercial tobacco addiction. Before going straight into the housing element, I want to briefly review what a general plan is. So it is essentially a blueprint for the future development and growth of a city. It is a long-term framework that really informs policy decisions of local jurisdictions. And the goal is to anticipate physical development and the growth of the community and the possible impact that development would have on economic and natural resources. I also like to think of it as a framework and a foundation for the building of a house that continues to expand every day, every year, and thus requires renovations, expansions, and additions, additional dwelling units, junior additional dwelling units to fit all the people joining the family. I would also note that the general plan, that there are 3 characteristics that are required by law. This is really important to center as I'm going through and presenting on the housing element, because this is a requirement that must stay consistent throughout any implementation or action items that would be introduced towards a housing element. These characteristics are that the plan and each element is long-term, it is comprehensive, and it is consistent. The idea that it is long-term means it has to reflect community vision for a span of years. In California, the typical plan for the long-term vision is about 20 years out. However, in some states like Oregon, it is 50 years. I would note specifically as it comes to the housing element, there's a requirement for updates every 8 years. I will go into a little bit more detail on that in a few slides to come. It's also a requirement that it is comprehensive, meaning it must be geographically complete. It includes areas the city could annex into, other areas of interest the city has due to their proximity to city limits, and it addresses all issues relevant to that jurisdiction. So again, when doing any work within general plans or any of the elements, any language or policy language, it needs to be comprehensive, long-term, and consistent within the element, but also all the other elements. One does not outweigh the other. One is not greater than the other. So without any further ado, I'm going to segue into going into the housing element. So one, it is a required general plan element. There are 7 main general plan requirements, and then an optional 8th one, depending on whether or not you meet the requirements of housing a disadvantaged community and some of the environmental risk factors that are associated with that disadvantaged community. But the housing element is actually the most dynamic and critical element in the general plan. It was first mandated in 1967, so that shows how long that communities and jurisdictions have acknowledged that there needs to be long-term and comprehensive and consistent planning regarding housing. The aim of the housing element is to provide structure and predictability to the process by gauging current and anticipated housing needs of a jurisdiction, and then proposing programs to fulfill those needs. This element actually requires review and certification by a state agency in its entirety. The California Department of Housing and Community Development plays that role in reviewing every local government's housing element to see if it complies with the law. And then it submits written findings back to each local government, which means when things are due in 8 years, that means there's a lot of work that's done beforehand, including early submission to the Department of Housing and Community Development to make sure that your finalized plan is in before that 8-year time is up. The approval is required before a local government can move forward and adopt its newly revised housing element as a part of its general plan. Now, the housing element has a revision cycle, and it's very specified. While jurisdictions can opt to update their housing element every 5 years or every 8 years, SB 375 in 2008 established a minimum of an 8-year revision cycle, which means the housing element must be adopted, as I said earlier, at the beginning of the 8-year cycle. If it is not timely adopted, there are numerous consequences, which I will address later. One of which is jurisdictions who do not adopt a timely housing element at the beginning of the 8-year cycle are subject to updating their housing element every 4 years, which means local jurisdictions who are on that 4-year track can sometimes start that work every 2.5 years to try to even submit it timely. This is a huge financial and time-focused burden that jurisdictions have. And so when communities get bumped to a 4-year review or revision cycle, there is a lot of planning, there's a lot of effort, and there's a lot of time that goes into that. And so it is preferable for communities to be on the 8-year revision cycle, just so they're not constantly in this cycle of always having to work on this every 2.5 years, which that's not a lot of a lead time to really have a break to really assess community needs when you're constantly revising and submitting. This 8-year cycle was adopted to better align the local government scheduling requirements regarding their regional transportation plans, which you'll usually find in the circulation element. These regional transportation plans are updated every 4 years. And so if the revision cycles are syncing up correctly, the idea is that there would be 2 regional transportation plans that are done in the span of the 8-year period that the housing element is, and that they would be done in conjunction. So according to the California Housing and Community Development Department, jurisdictions that fail to adopt a housing element that have been found in substantial compliance within 120 days of the statutory deadline to revise the housing element must complete all necessary rezones within 1 year of the statutory deadline. This means that the jurisdictions must adopt the housing element, and the housing element must be found in compliance, meaning that there's a letter from the HCD affirming the compliance with the housing element law within that 120 days of the statutory deadline, or they need to complete these rezones within 1 year, as opposed to 3 years to maintain the housing element compliance. Jurisdictions that adopt more than 1 year from the statutory deadline cannot be found in substantial compliance with the housing element law until the local government has completed any required rezoning, which then would kick them into that 4-year revision cycle. SB 197, which was signed into law on June 30th, 2022, changed the rezoning deadlines for jurisdictions with the statutory housing element deadlines in 2021. Now, jurisdictions with a 2021 housing element deadline may maintain the approximate 3-year rezoning deadline if their adopted housing element is found in compliance within 1 year after the statutory due date. So again, the housing element that is adopted and found in compliance means that HCD has completed its review of the adopted element, issued a review letter, and then has found that the element is in compliance. So how does this impact communities' intent on adopting provisions with smoke-free multi-unit housing goals? That means that the community work and engagement needs to be done before bringing this policy language to the table. And I'll go more into this at the very end regarding how do commercial tobacco regulatory policies fit in. And one of the things I would note is when you're seeing this 8-year revision and communities or jurisdictions start working on it 2 years before it's due, or if it's 4 years and they're working on it 1.5 years to 2 years before it's due, that means that communities and people who are working in commercial tobacco product regulation need to, one, be aware of where their elements are in their revision cycle. They need to be aware of the comment in the review period as it is applicable to their local jurisdiction. That's typically found on the jurisdiction's general planning or its city website. And they have a specific web page that would be dedicated towards their general plans. And typically you'll find any information regarding if there are draft revisions, when they need to be submitted, and when there's public comment and review. So I want to get into the process. And part of the process of the housing element is, and the first would be to update the previous housing element. There are some public participation requirements regarding the housing element review process, which is prior to submitting the first draft within a planning period to the HCD, the local government must make the draft available for public comment for 30 days. And if any comments were received, they have to take at least 10 business days to consider and incorporate public comments. Well, how would this work then for people doing commercial tobacco regulatory work? You would want to be aware where the draft is, potentially seeing if you can reach out with the city planner or the people doing this work to see if there's an available to have the draft before then. If not, it means being aware of when that draft is released for public comment, reviewing it, and making sure that's done within that 30 days. That's not a lot of time. And so there should be, again, the community engagement, surveys, and co-creation that should be occurring before this draft is released, as there's just not a lot of time to make full comments on this. Then there would be a submission of the draft to the HCD after they do the 30-day period for public comment, and then they review the public comments and incorporate those edits. They would then submit that draft to the HCD. That is the first review approval that would occur. And then the review takes up to 90 days, which means when you think about that, and it has these housing elements need to be implemented on the top of the 8-year revision, that means that you still have to account for the fact that HCD could make changes or alterations or have you go back to the table for more areas, meaning that input should probably be done at least 1 year to 6 months before the revision cycle to really account for all of these timelines. Then at that point, when the HCD does their review, they would send it back to the local jurisdiction, and then there would be the need to revise and adopt or adopt without changes. Now, there is some transparency requirements. For any subsequent revisions, the local government must post the draft revision on its website and email a link to all individuals and organizations that have previously requested notices relating to the local government's housing element at least 7 days before submitting the draft revision to the HCD. They would then submit the revised draft and adopted housing element to the HCD, and then subsequent reviews would take up to 60 days. So again, this is a very lengthy process just for the review for the HCD, that's a total of five months. So that really needs to be taken into consideration. But the transparency requirements are really fantastic because it allows local public health organizations to really take a look at what the jurisdiction's vision is for housing, and what the language looks like, to see if there's anything that is overlooked or missing, to really account for certain community members who have really been impacted by second and third hand smoke, as well as tobacco product waste. So the transparency requirements are really fantastic because it gives us the opportunity, or grantees the opportunity, to have input and insight into the process. So why does the housing element matter? As stated earlier, the housing element matters because it is mandated by state law, and it must be adopted at the beginning of the 8-year cycle. If not timely adopted, there are numerous consequences. State funding programs for transportation, infrastructure, and housing often require or consider a local jurisdiction's compliance with the housing element law. And these are competitive funds, and they can be used for fixing roads, adding bike lanes, improving transit, or providing actually affordable housing to certain communities. So there's a lot of benefits to, if this is done timely, for the funds that you can competitively get into grant for, but there's also consequences if you don't. In some cases, funding from the state and federal housing programs can only be accessed if the jurisdiction has a compliant housing element. In other cases, a compliant housing element is not a requirement in order to apply for funding. However, in those situations, they have a point system. And so if the housing element is done timely, they can receive extra points on their application that can really elevate them ahead of other people applying who don't have that done. And so it really increases their chances in the competitive application process to bring in needed funding to a lot of communities. Now, state funding programs that require a local jurisdiction's housing element compliance include the Community Development Block Grant Program, the Infill Infrastructure Grant Program, Local Housing Trust Fund Program, Affordable Housing and Sustainable Communities Programs, Permanent Local Housing Allocation Programs, as well as Caltrans Sustainable Communities Grant Program. Those are a lot of communities or a lot of grant funding opportunities that are really hinged on whether or not there's compliance in the housing element, which especially for certain communities who really need that funding, this is really an added incentive, but also an element of worry too, if they don't have the proper funding to really address the issues with their housing element or their general plan, because it takes a lot of time and effort to really attend to this and to do this timely. There are also state funding programs that engage with incentivization for greater coordination with housing planning. And those include local partnership programs, which are projects are evaluated in how they advance housing element goals. And I want to caveat that because housing element goals can mean many things. And I have some examples for certain jurisdictions at the end of this presentation, and also some suggested implementation items. But I would note, for instance, if there's an element goal to address health inequities in multi-unit housing, and there is an enactment of potentially like a comprehensive smoke-free multi-unit housing in that jurisdiction, that is a way where a jurisdiction can show that they've advanced their housing element goals, right? Or for instance, if there's an understanding of tobacco product waste and that it can take the form of third-hand smoke, and third-hand smoke, as we all know, can adsorb into materials like furniture or wood or the plywood or the plaster, and it can really degrade the value of the housing stock. And it can result in the need to do more repairs, and it really degrades the building over a period of time instead of preserving it. And so if there are policies that are enacted that are showing how they advance housing element goals, a community in a jurisdiction can say, hey, this local partnership program, we've advanced these aspects of our element due to the work of grantees working in commercial tobacco regulation. This could qualify a jurisdiction, and that is a huge benefit to really advocate for how local grantees and local organizations can really offer support and insight to communities and getting that competitive edge for grants. There's also the Transit and Intercity Rail Capital Program, and projects must document how transit ridership growth is supported by housing policies, including evidence of compliance with state required housing plans. And so, especially with like rural jurisdictions or jurisdictions that are very dense in housing, this is a really amazing project that you could get an edge or competitive edge just because of the compliance of the housing element. There's the Active Transportation Program, which does infrastructure projects, and it must address the potential to support existing and planned housing, and planned projects must be consistent with local housing policies. So if the local housing policies are to preserve housing stock and to reduce the impact of third-hand smoke in housing stock, the planned projects and the model policies that could be suggested by people doing this work in commercial tobacco regulation, this is another area where it is an easy argument to be able to say, hey, this is how I've been compliant with this, and this is the proof of the policies that have passed and how they're really showing the compliance with the housing element. Second to last, there's the Solutions for Congested Corridors program. That projects must address how they support infill development, which may include identifying housing element policies that streamline multifamily housing development. And then lastly, there's the Home Investment Partnerships Program. Applications receive points for the housing element compliance. Just again, when you have your 8-year revision and it's done on time, you can receive points. And again, it's just a way to make sure that communities are being poured into for funding regarding housing. California is in a housing deficit, and over the next year, I think if I'm not mistaken, I think there'd be a need to create over 300,000 additional units every year for the next 8 years to make sure that the housing needs are met, which is saying a lot. And so for jurisdictions that are ultimately really struggling with housing, these are really like important incentivized areas to get the funding into their community to create more multi-unit housing. So in order to create a housing plan or a housing element showing it could meet the local housing needs, a jurisdiction must first know how much housing it must plan for, and then estimate how much will be needed at a variety of affordable levels in order to match the needs of the people who live in that community. And this is determined by a process called the Regional Housing Needs Assessment. And I'll say that again, the Regional Housing Needs Assessment. So these are statutory requirements for the housing element, and they can be found in the Government Code section 65583. There are 6 housing programs that are required by statute, and these are the needs assessment, the housing resource inventory, constraints analysis, zoning for homeless shelters, housing programs, and then other considerations. I'm going to go through these requirements one by one. The first is not the steps that I mentioned, and it's not required, but it is actually the suggested first step communities should take when going through their housing elements updates. And that first step is review the previous cycle's element. Look at the shortcomings, what didn't work, what wasn't achieved. So for instance, if there was a smoke-free multi-unit housing action item, meaning that the goal was to enact a smoke-free multi-unit housing model policy, and that did not occur, right? You need to address and look at that as a jurisdiction. And so why didn't it work? What wasn't achieved? And then also look at the successes. What did work? Was this a goal that was met during this element cycle? And really looking at that. And then quantifying those results of the successes as well as the shortcomings, and then qualitatively analyzing how the previous element achieved its objectives. That's not strictly required by state law, but it's very helpful as it helps set standards and planning objectives. One of the things that I really do think is a golden rule in enacting policies is that it needs to be measurable. A lot of jurisdiction will use broad stroke language, and while that might be good to get your foot in the door to really start considering areas that jurisdictions haven't tackled before, broad brush language like consider a housing element regarding smoke-free multi-unit housing all it really does is that the jurisdiction needs to consider it. There's nothing really attached to how it's measured. Does that mean that they have 7 meetings? Does that mean that they invite stakeholders to come and talk? What does consider mean? Or does it mean at one meeting, someone's brought it up, they looked at it and they're like, oh, it's not for us. So making sure that, like, again, when you're reviewing the previous element, really look at what was successful, why was it successful, what failed, and really looking at the language. I love language and I love the power of what words can do, and really looking at general plans and seeing the successful ones and the ones that really didn't get those policies through, really looking at the language that was chosen and seeing whether those goals were measurable or not is super important. So the needs assessment, one of the first requirements, by law, the housing element must quantify and address existing housing needs within a community. That means all data regarding population size, and they do demographic breakdowns of this data. How has the data changed over the years? How is it going to change going forward? There's also going to be an evaluation of the characteristics of existing housing stock. And this is actually really important, I think, in the third-hand smoke. And the characteristics of existing housing stock would be the number and type of existing households, the current housing price rates in relation to average household income in the community, and then the inventory of available and unused or vacant housing units. I also think you could also incorporate in the characteristics of existing housing stock, which housing stock did not have smoke-free policies. And then also potentially, I'll do this again later, but the Third Hand Smoke Resource Center is a fantastic organization, and it actually sends out testing kits that are available to each California resident. And one of the things that can happen when they have to do this needs assessment and the characteristics of existing housing stock is there could be a requirement in the housing element model policies and action item to really assess what is the third-hand smoke impact and what has that done to the current housing stock in certain units, and really pairing or working with property managers when appropriately assessing what is the actual character of that housing. So that's extremely important in a way where you can get an in for talking about third-hand smoke, and the impact is really looking at what is the characteristic of existing housing stock. Now, each municipal planning organization or council of governments prepares a regional housing needs allocation. And so MPOs or COGs would receive housing allocations for their region from the state at the beginning of each housing element cycle. And then they would then receive, so these housing allocations are then distributed farther down the line to cities, towns, counties within that region. So again, a region doesn't have to just be like a county. It can be greater than a county, and it can include multiple counties, multiple cities. But again, that is broken down into 4 income groups. Very low income is one of the designations, and that means it is less than 50% of the region's median income. This has to be accounted for, this allocation. And especially with a housing crisis and people being able to afford rent, this is going to become more and more prevalent, I believe, as allocations should really increase to reflect that in the community for very low income to increase that availability, as well as low and moderate. Low income means that this housing allocation is earning between 50 to 80% of the region's median income. The moderate income means earning 80 to 120% of the region's median income. And then market rate would be an assessment of earning over 120% of the region's median income. So these are these different allocations, and they again are distributed from the region down to cities, counties, and towns regarding these 4 different groupings. Jurisdictions can protest their allocation, but once assigned, they need to show how they will meet that allocation. And that's super important, because once it's set, it's set. So for instance, if there is a city that thinks that they should only be at 20% very low, but they're assessed by their region at 40%, they can argue and protest it. But once a final determination is made, they really need to reflect in their general plan housing element what they are doing to meet that housing allocation designation. A jurisdiction should also include an analysis of shortcomings of available housing options, including households where low income and renters are overpaying for housing, and incidences of overcrowding, which means there's more than 1.5 persons per room. I would note the caveat on this one is this really doesn't take into consideration persons who have come into the country or in the country and they don't have a legal status within the country, whether they have a green card or something to that effect. And so what happens is there's an overlooking because people are scared and don't want to interact with local governments because they don't want to be kicked out of the country. And so there's also a situation where there are certain community members that are really overlooked. Their needs are not addressed because there's a fear that it could negatively impact them. And so there's also, I think, a need to really work with people in the community who have a trusted and respected interaction with persons who are residents in this country without a legal status to it. So that way their needs, how they're impacted, can really be centered as well, instead of constantly being overlooked and not taking into consideration that there's not going to be a real assessment of needs, since they're going to be hesitant to respond to questions or even answer them. I would also note that both qualitative and quantitative analysis of incidences of overpaying and overcrowding should be provided in order to tailor the new element to address these issues. I unfortunately have a partner who is very addicted to TikTok, and I am constantly seeing in all of these different states people posting regarding overpaying or overcrowding. And it's not just New York, it's not just California, but it's in so many different states. And so there really needs to be a centering of the fact that there are many people who are in situations where they are overpaying, they are barely making even regarding making sure they pay their rent and all the other life necessities that they have to pay for as well. And this should really be centered in new housing element revisions because it is a growing epidemic. Special populations include seniors, persons with disabilities, and that is the legal designation, which is why they say persons with disabilities instead of persons who are differently abled. But this also includes developmental disabilities. So for instance, like group homes, large households, seasonal and permanent farm workers. And I would note again with the seasonal and permanent farm workers, as well as like large households, there might be some consideration for the fact that there is a very real fear of the government interacting in certain individuals' lives because of their legal status and not wanting to have negative impacts for their family. But then more special populations would be female-headed households, and then both seasonal and year-round persons who are unhomed. This list is an actual list from Government Code 65583, Parent A, Parent 7. So that list has to be addressed. It is part of the law. There should also be statistics and analyses of existing needs and projected changes over the life of the housing element that should also be incorporated. This needs assessment is huge, and when you really think about what a jurisdiction has to do in the revision of its housing element, the work of commercial tobacco regulation could potentially get lost. And so it's really important to cultivate relationships and make sure that there's an understanding of language that can be helpful, language that could easily be implemented into these elements and general plans, and then also knowing like when is the timing and making sure the timing is right instead of waiting until the last minute. There's also then the housing resource inventory that is required. It must address availability of resources and the nature of the constraints on these resources. It should address land availability and inventorying sites suitable for future residential development, including mixed use zoning. It's also based on current zoning standards and access to public utilities and facilities. So for instance, like how close are they to like a water treatment facility or a hazardous waste facility, waste management, et cetera. The current zoning standards need to make sure that wherever this residential area is being zoned to, that it's getting access to all of the appropriate utilities and facilities it needs. Adequate sites not zoned for residential development may be identified for rezoning, as long as a program for this rezoning is included. I would also note too, and this is just a shout out to why we have an environmental justice element. You can see that there were in certain jurisdictions that there were areas that were zoned for heavy industrial or light industrial, but because there was such a growing need for housing, that some of these areas then opened up for residential use. The concern with that is when you're dealing with disparities and long developed systemic and structural racism, you see a lot of persons who come from disadvantaged community backgrounds that end up in jurisdictions that had former like heavy industrial waste designation or light industrial, and you start to look at the impact of groundwater contamination, the political and social determinants of health and how they're impacted by their airways and all of these different pollutions and particulate matter that is impacting the people in the zoned areas. So when there's identifying for zoning districts, there should also be an assessment as to can the current issues in that zone be mitigated so it is safe for people to be in those zoned areas? Or is there a need to potentially rezone other areas that are more suitable for housing opportunities and zone potentially like commercial businesses to that area instead, where there's not going to be housing and a lot of drawing of groundwater in that business? Now, the element should also identify zoning districts and densities that may be appropriate for low and moderate income housing and any standards that would prohibit these areas from being developed to meet those needs. And that's super crucial because we come from a long-standing tradition of just single residential family zoning, which ultimately, as we become more and more educated regarding how our country is developed, has been extremely racist and the prohibition of persons from disadvantaged communities to have access to that. And so making sure that, again, the zoning districts maybe also taking off that designation of single family residential and opening it up to also multi-unit family housing as well. And so really examining were the past ways in which communities and jurisdictions approached zoning, was that appropriate and was that equitable? And then also it should analyze whether those sites identified for residential facilities have access to public services and utilizes, and whether sufficient sites are available to provide housing for all sectors of the locality's population. If sufficient sites are not available, the element should address this by creating programs that will help create sufficient sites before the 5-year planning horizon. And so this is a mandate. Communities don't get to just say, oh, well, we don't have any available area anymore. It needs to be developed in the plan then. There's also a need for constraints to address both governmental and non-governmental constraints that can occur throughout this process. A governmental constraint may include permit procedures, other processing and review requirements required for residential development projects. There are different requirements for single-family subdivision development versus the requirements for developing multi-unit housing, transitional, or emergency housing that would need to be addressed. It could also include fees, exactions, and off and on-site improvement requirements, as well as any amendments to state housing law or uniform building codes, land use controls such as zoning, development restrictions, and then standards that may limit the building of multi-unit housing or lower income housing. Each constraint and attempt must be made to limit its effects by creating program responses and adjusting standards. So again, there needs to be a real analysis of like how the government operates, and then what are the constraints, and then anticipating them and addressing them. It's not enough to just say, hey, these are our issues. There needs to be a plan to address them. Now, there's non-governmental constraints that are mostly related to market constraints, such as the availability of financing, the cost of construction and development, and also the price of the land. So that needs to also include multi-unit housing at risk of conversion to market rate units. And it estimates the cost of replacement versus preservation, identifying preservation measures, and the impact of third-hand smoke and identifying its impact on housing stock. Also, you must identify energy conservation measures and opportunities as they relate to the possibility of reducing development costs. Now, the housing programs, by law, each program must contain quantified objectives for the provision of specific types of housing. And there are 6 that are required by statute. The site inventory, which is an inventory of sites available for the provision of needed housing at the 4 income levels, very low, low, moderate, and market rate. This program needs to work in conjunction with any rezoning, and it must identify current sites and help provide further necessary sites for special needs housing opportunities. And the list of special populations that I listed earlier by statute, this would apply here. Affordable housing programs assist in developing housing adequate for needs of low and moderate income households, and includes direct financial assistance programs or programs to provide developers with assistance in obtaining tax credits for low income housing. There should be a mitigation of government constraints. So what I talked about earlier, potentially removing or mitigating these constraints, which could allow for waiving fees, minimizing delays, permit procedures being expedited, and then levels of the review process being collapsed for development projects, to really promote the ability for the construction of more units available for housing. There's also the housing conservation and rehabilitation, which is conserving and rehabilitating current housing options by improving residential hotels, maintaining affordability restrictions on existing housing, such as rent control, or promoting rehabilitation loan and grant programs. There's also equal opportunity, which means programs are set up to ensure that there's equal opportunity exists for all persons in terms of housing, promoting literacy and housing laws, creating local equal opportunity housing programs as a method of dealing with cases of discrimination. And then lastly, the affordable housing conversion. And this is a huge one, and we can see this sometimes when there's the gentrification of neighborhoods that are in disadvantaged communities to serve the purposes of a market rate for persons who have access to wealth and power. Housing elements should strive to maintain affordable housing stock by analyzing and minimizing the risk of conversion of that housing to market rate uses. This means by which this maintenance occurs will be different for each locality, but there should be a warning system that is set up to help officials monitor the location and quantity of at-risk units that could be converted to market rate. And then the assistance should be provided to tenants who are affected by this transition or conversion. So there's also the requirement for zoning for homeless shelters. This means that the use of this is allowed without any discretionary approval and provided it meets any applicable objective criteria. So jurisdictions are required to show that enough land areas have been assigned to zoning designations, which would allow homeless shelters so as to allow production of emergency housing commensurate with the need identified in the housing elements need analysis. This means there's a minimum of 1 potential shelter. They're required to show this. And then they also must show that the standards of approval are not so cumbersome as to obstruct their production, and in fact, that it would encourage it. Then there's also the other considerations, which SB 375 requires additional processes. This includes an expedited timeline for the creation of housing programs and zoning designations pursuant to a jurisdiction's housing element. If a jurisdiction fails at this, SB 375 requires jurisdictions under certain circumstances to accept development plans for potential housing sites as if they had already been rezoned, and allows interested parties to bring litigation against a jurisdiction for its lack of compliance. Local jurisdictions must publicly account for actions taken to implement their housing elements on an annual basis, due to Government Code 65400. And I would like to note that for jurisdictions who have visions or goals of smoke-free multi-unit housing, there is a forum to address a jurisdiction's inactions and taking steps to enact these policies. So this is really where people working in commercial tobacco regulation, this is the part that we would want to be really aware of, which is the public participation. So as a part of its review of the housing element, the Housing and Community Development for the State of California must consider any written comments received from any public agency, group, or person. If an organization or individual plans to provide comments to the Housing and Community Development on a jurisdiction's housing element, early contact with the assigned review staff member is encouraged to ensure that the housing and community development is aware of this intent. To ensure that they have sufficient time to consider comments in the review of the housing element. Written comments should be provided within the first 30 days of the review. Written comments could also be provided directly to the assigned housing and community development analyst or emailed to housingelements@hcd.ca.gov. I would also note, though, part of working in this area is developing partnerships and relationships. And so really making sure that if there is the desire to engage with critical stakeholders in the community and to maintain relationships to do this work alongside for how many years, really being aware of that 30-day comment period already made available by the local planning commission or the city manager or whoever is in charge of the revision for the housing element. Having communication with the person in charge there really saves a lot of grief if you go over their head and then go to the housing elements at hcd.ca.gov. So you can do both, but it's important, I think, to really be respectful of the people doing the work and working alongside them instead of working against. I would also note that while this element has to address these specific state statutory requirements, it ultimately is a local plan and it's supposed to reflect the vision and priorities of the community, which is great, which is why surveys, going on the ground, interacting with people who are impacted by this, including second or third hand smoke or the aggregation of tobacco product waste near their housing areas. These are really key areas to really engage with these individuals and to really bring that to the forefront and adopting visions and goals that really address all of the needs regarding the housing element. Now, here are some examples that I have of different jurisdictions putting different aspects of whether it's smoke-free or housing stock related, but in their housing element. The first is Coachella. Coachella addresses second and third hand smoke and its impact in housing in two different locations within their general plan. Their community health and wellness, and they're also their sustainability and natural environment. Now, as you'll note, those are not like the main named elements that you will see in a statute. A lot of jurisdictions don't go by the individually named element. They will find and do basically like a community focused element creation where the name of the element reflects what the focus is and it incorporates statutory requirements from various elements. So a community health and wellness would probably really get into environmental justice. And then as for sustainability and natural environment, like conservation and open space. So they're really addressing this. They're just differently named to better reflect the approach the community wants to take and centers the community's goals. So as you can see, there's tobacco-free youth, secondhand smoke, and smoking cessation services. And they do this by doing the policy, then the goal, then the policies. And so they have that overarching policy, and then they just mention goals. So again, it talks about healthy homes, and it really takes into consideration the environmental tobacco smoke control. So these are ways in which, if jurisdictions want to even go further, they can start to really have like a healthy homes assessment and start really taking advantage of reaching out and working hand in hand with the Third Hand Smoke Resource Center if they wanted to really address these and have really measurable outcomes regarding the jurisdiction's housing stock and its building and green building practices. There's also San Diego City, and what you'll see for their smoke-free multi-unit housing is where they have these goals and objectives. They want to enhance quality of life, which is a broad stroke goal of health. And then again, they go into protecting public health and safety. But the language that they use that incorporates commercial tobacco regulatory is really broad stroked, actually. And so it says, consider the adoption of a comprehensive smoke-free ordinance for multifamily housing properties that covers the entire property. Now, when you look at that language, and I just want to highlight that for a second, and I brought this up before, to consider the adoption, that is not necessarily a measurable goal unless you also take into consideration a requirement of like 4 town hall meetings, 3 meetings with stakeholders, engaged with local jurisdictions who are doing work in this area to become educated and more informed, to have a town hall where there is a survey collection for the need and the desire for this thing, right? These are very tangible ways to really move towards a smoke-free ordinance or just incorporating it into the zoning. But again, being aware of sometimes the broad brushstroke language doesn't actually have a measurable goal towards the work of commercial tobacco regulation. This is East Palo Alto, and East Palo Alto just has a policy resolution. It's not like an action item, it's not an implementation measure, but it's a policy resolution to develop a smoke-free community. And then which includes a specific policy dedicated to smoke-free multi-unit housing. And so this is, again, a jurisdiction that seems like it is breaking into this. So looking at smoke-free multi-unit housing and affirming like that landlords can establish smoke-free rental units. So it doesn't have like the enactment, but it really pushes a jurisdiction towards enacting a comprehensive smoke-free multi-unit housing model policy, which is a little bit more concrete language than the language that we saw before. Then there is, and I say this wrong every time, Tulumne. And someone feel free to correct me when we go into the discussion portion. I will eventually get this right, and I try every time. But their goal, they have really broad goals, and I really liked how they organized their general plan. It was very type A, and I love that. But they have the goal, and it's color coded, and then they go into the policy and implementation programs, and it's like that throughout their entire general plan. So it's really easy to read. So their goal, an entire goal, was reducing secondhand smoke exposure to residents in multi-unit housing developments. Potentially, like as people are going into this work, I want to also do a shout out that you don't see a lot of incorporation of tobacco product waste in any of this language. And so just noting, some people like their grant is only going towards smoke-free policies. It's not necessarily incorporating tobacco product waste, but we know that tobacco product waste has a huge impact on our lived environment. And it really impacts like through social and political determinants of health, the outcome of the people living in those areas. And so here with these goals, we can, talk about secondhand smoke exposure, but we can also incorporate reduce secondhand, third-hand smoke exposure, as well as tobacco product wastes, and how it impacts residents in multi-unit housing developments. Those are ways in which people can expand. But they go in, they do their policy item, and then they have their implementation program. So the encouragement, the exploration, and the consideration. They don't have create. Create is a pretty strong word, and people don't want to be held accountable for creating language and then just not following through on it. And so that is a balancing act that a lot of people doing this work would need to consider. And also create language to really bridge the gap between just consider and create. Now, I wanted to also really reflect, and when I did the housing element on the Communities of Practice General Plan call, I wasn't able to reflect this as much. And so I really wanted to incorporate some implementation options. And typically they're some of them can be in bullet point format. They're not really like full sentences that you would see in the housing element, as you kind of saw how segmented they were in those previous slides. But one of the policy implementation items that jurisdictions could consider for their housing element is community engagement to assess need and desire for smoke-free multi-unit housing model policies. This seems really simple, and it doesn't seem necessarily effective because there's no creation, there's no model policy that's being done. It's not saying what's prohibited. But as we're all aware, city council members and county boards of commissioners, when policies are being presented for them, one of the huge considerations is going to be is what does the community want? Because again, people are elected by their local jurisdiction. And so the local jurisdiction, if they're coming back and they're assessing and saying, hey, like 86% of us are impacted by second and third hand smoke, and 72% of us are for the implementation of smoke-free multi-unit housing model policies, or it's 90. Those are all things that really impact, as maybe in that next 8-year revision cycle, the goal changes because that's been done. And it becomes just the enactment of multi-unit housing model policies. Another policy implementation option that you could see in the housing element would be the co-creation of smoke-free multi-unit housing model policies. And I say co-creation for a reason. Co-creation is extremely important. It really engages with stakeholders, other people that are connected with this. It incorporates like the impact of youth engagement, and then also like vulnerable population members who really are being impacted potentially through the health and the impact of second and third hand smoke getting into their units. This co-creation really looks at, hey, maybe some of these policies that we're creating, maybe they impact certain community members negatively versus others. And so co-creation keeps us accountable regarding how we interact with others, how we center others, and then also understanding that everyone comes in with implicit bias. And because you come in with implicit bias, you cannot really capture everything. And people have the amazing thing that they're able to offer with their lived experience. And so when we have people from many backgrounds, economic, and then also like those who really experience systemic and structural racism, we're really able to see and gain insight regarding how could this go wrong? How do we consider this? And is the thing that we're creating, is this something that's signed off on by everyone involved here or most of the people involved? So that way, whatever is being enacted is really a law that is wanted by the people and it's for the people. There also can be action items regarding, and this can also be incorporated into the housing element. You can just state that the goal is to, or the implementation measure is to educate landlords and property managers regarding the risks of second and third hand smoke. So landlords and tenants can be told about the fire hazard of improperly handled smoking materials, including electronic smoking devices, which have been known to explode and catch on fire. That is a really serious consideration. And so that can be incorporated into the housing element. There also can be, you can state that there could be the education of multifamily property owners and managers about the effects of second and third hand smoke and encourage them to include anti-smoking policies and rental agreements. And then you can also include in that language the connection of property owners to resources such as model lease language if they want to ban smoking in their rental units. There's also the opportunity to develop and implement a healthy homes inspection to assess pollutant exposure. And this is really a great opportunity to go into the area of third hand smoke and identifying its impact on housing stock. And it's a really strong area where smoke-free multi-unit housing policies and visions could be incorporated. But I would note that when looking at that, you could work with affordable housing advocates and community leaders to identify and remediate environmental health hazards of existing housing stock, but also I'm saying in this jurisdiction, if they wanted to do a healthy homes inspection and incorporate that, they can also incorporate like the testing kits that are available at Third Hand Smoke Resource Center. And I just want to do a shout out to them again, because this housing testing kit can really assess the third hand smoke impact in each unit, but also in the common areas too. And that can be then used to go forward and really make strong arguments for this is impacting, here's the science to back up the claims and why steps need to be taken to really address these long-term impacts of third hand smoke on specific community members. I also do want to do a shout out to the Sierra Club. The Sierra Club will be releasing shortly a general plans tobacco product waste model policy toolkit. And I highly recommend to anyone in attendance today to view the webinar they're hosting on October 18th. Some of the suggestions and the insights you saw here regarding tobacco product waste, things like them will be found in their toolkit. And so that's going to be very powerful regarding tobacco product waste model policy implementation for people who haven't been doing that work and want to gain more understanding in it. Sierra Club has done a great job. So that is the end of my presentation. I know that went a little long, but that's why I went for the hour and a half to give time for discussion and questions. Does anyone have any comments, thoughts, insights regarding the housing element? Are there questions on how this implicates commercial tobacco regulatory work or questions about the presentation? I am going to end my slideshow so I can see who's asking questions. Okay, so the first question is from Erica Burian. Let me know if I pronounced that wrong. I apologize. Will there be any upcoming webinars, presentations, case studies from counties who have dealt with the housing element? I would love to know what has been done in the past, especially in regards to health equity and smoke-free multi-unit housing. Actually, these are very good questions. So right now, and just this is also a shout out to CTPP, they're doing a series with me every month regarding, and other community members who really are on the forefront of doing this work regarding general plans. So every month there is a hosting regarding each element or aspects of elements, and then talking about that. One of the things that we're looking at down the road, and there's going to be a training survey that I really want people to fill out because there's conversations regarding offering a regional training in potentially Northern California regarding general plans and doing a hands-on workshop regarding, for instance, like a community member would bring an element that they're working on or element that's in revision in their community. They would do some work beforehand that we would assign out, and then they would bring that element to the regional workshop, and then it would be worked on with people who are working and focusing on these areas like me or Sierra Club and really giving input. So that's something that would be explored, but I think through that, I'm also doing some research right now, and I have 2 research assistants who are working with me. They're both law students who are amazing, and they're going through every single county and city right now, and they are pulling out any language regarding general plans, which in whatever element, whether it's housing or other areas or conservation or open space. I think there would be the opportunity to really assess and quantify that data to reach out to the communities who are doing that work in the housing element, because we will have an actual list of community members and seeing whether or not there is a case study regarding that process. So these are things that can happen and develop, but a lot of it is engaging in the work of assessing who has it. There's so many general plans, and if people have had the opportunity to go through a general plan, some of them are like in San Francisco, they can be like 850 pages long, which is like really long, but it's also a really large community. So that can take a lot of time to really go through in detail. But my hope is that once that information is gathered and analyzed and quantified, we would then be able to go forward and really look at like potential presentations of what are the successes that happened in communities that have done work in the housing element. Why have they been successful, and what is the language that they used? Which I think would be very helpful, because I think people learn best through kinesthetic interaction, and they also learn best from the people who've kind of trailblazed into that area. And then they're like, hey, we're going to report back on the things that we've learned and how we've grown and what we've accomplished. So that way people can feel more confident going into this area that they're unfamiliar with. So Erica, I think those are really great insights. And I think there's going to be more going into it, but there's just this need to evaluate who's doing the work currently here in the presentations and all of these calls, but also which communities have it, and then looking at what do they have in common regarding why they have enacted this. So that would be a fantastic thing down the road to really center that in doing work of commercial tobacco regulatory work in the housing element. So let me know if that answered your question, but I do think we'll be able to get more into those areas in the weeds that you mentioned regarding health equity and smoke-free multi-unit housing in the past, once we have, again, that list of communities that have it, and then reaching out and again, synthesizing that data. Rebecca Brandstetter, what has been your experience with enforcing no smoking lease agreements? So one, I have not enforced any no smoking lease agreements. As just doing attorney work, it's again like legal technical assistance. But I would also note that before this, I was a public defender for several years, and I also worked with the Federal Defense Bar. And so I've seen it from a different end of how enforcement puts people in the track of eviction, which I'm anti-eviction. And so I think there are some smoke-free multi-unit housing model policies that we are developing in California. And we're also working with other jurisdictions that really want to consider and center the resident to making sure that eviction isn't occurring, but also that there's accountability with the enforcement of, like, if a property owner or manager has a no smoking lease agreement, that they are actually enforcing it. And so sometimes that means in the model ordinance or the policy, really incorporating, hey, if you have like a 2-tier system, which the first tier of the, first, second, and third complaint are interacted with the local Department of Public Health. And then at a certain point, then that gets elevated to pulling in the landlord or the property manager. Once the landlord or the property manager is aware that they have requirements to show that they are responding and they're having a reasonable response and it's in writing, so they're being held accountable, and that they can be held accountable for not enforcing. Because a lot of when I've received smoke intrusion questions from residents throughout California, the big issue is, we have a smoke-free bubble policy already, or a lease agreement, and they just won't do anything about it. And so I'm really looking at what is the process in place with the local public health department, or if they use code enforcement or law enforcement, what are ways to address that without increasing confrontation between the resident and also the person who is smoking, but then also making sure that there's some equity processes in place so that way it's actually addressed and it just doesn't dissipate into the ether, never talked about. So I would say here, like, when looking at this, I think the goal for a housing element would be to have specific action items. But if you're looking to go into like the enforcement of no smoking lease agreements, I think a standalone model ordinances, potentially you could have more detail and more language. So that way there's not this like intensive focus just on second, third hand tobacco product waste in the actual element, but it's actually addressed in this separate ordinance to really consider like equity in this process. So I hope that answers your question. I don't do any enforcement. I've never done enforcement. I'm aware of the issues with enforcement because I worked with people in disadvantaged communities who were on the receiving end of really negative enforcement regarding these policies. And so that really does bring a balance to how I consider language and making sure that there's an equitable process in place, but also that there is a process in place to protect the health of residents, as that does take precedence.
Hey, Rachel, we do have an attendee who would like to ask a question out loud.
Yeah, go ahead.
Hi, my name is Mickey Hong. I'm at Mills College at Northeastern. I am a investigator of potentially a principal investigator of a project that's going to look at general plan goal language in tobacco control and evaluation. So going back to hark on your presentation of how do we make this language like accountable later on down the road. So I have an evaluator on my Boston campus. I'm over on the West Coast, so she's on the East Coast, but she's going to evaluate some language that we're going to examine with some consultants who are working on certain cities like Hayward. And we are in the midst of trying to get this great team organized around a general plan that's evolving and update. And we're looking at multi-unit housing. The issue here is that, evaluation, and I don't know if you're an evaluation expert or if you know much, but, there's a program in place, and then there's intervention activities, like you could go about talking to landlords and tenants, engage the media. And then there are some outputs, like did it raise awareness? Were there all these, surveys you answer? But then there are outcomes, right? Like did ordinances get passed, and, morbidity, mortality, 5-year, 10-year. What I'm trying to do with this present proposal, it's with the American Lung Association. It's one of their public health policy proposal. RFPs is that I have the evaluators, I have the consultants, I have access to the general plan, the city planners, the people who are gonna put it together. What I need to do is get in touch with the local coalition people, right? Because they've been working in that jurisdiction on multi-unit housing. I don't want to step on their toes, but I want to bring them into our activities because we're not going to do the engage the landlord, engage the media, mobilize tenants. They're going to do that, right? That when do they come into that general plan like commentary period, say we're going to do the intervention activities, and then we come over as the research saying we're going to evaluate the outcomes. We're going to tell you if this like multi-unit housing strategy worked in the general plan. It's like, how does that all come together? And can I talk to you later next week or something? Can I follow up with you?
Yeah, of course. I would love to follow up with you. This is very interesting. I'm very excited, as you can see. But I would say one of the things that I talked about at the beginning with the implementation measures would be your surveys with the community and understanding who are stakeholders. That's all stuff that should be happening way before public comment, especially when you're wanting to go into this work and seeing what is your work focus. And sometimes this can happen by reaching out to the city planner and asking who are organizations that participated the year prior. They should have a list of that. And if they don't, cold calling. I just like reaching out to organizations that are doing that work and then reaching out to people in that area. And then they know people because that's how coalitions work, right? Everyone is connected and they're focusing on specific areas, but that end goal would be potentially that smoke-free multi-unit housing model policy. And so potentially doing that work and engaging quite a bit earlier, and then also through seeing who shows up in the town halls. All of those are things that you would assess to see whether or not you have that community stakeholder engagement, and really pairing with people who have done that work, acknowledging that they have expertise and wisdom in that space. So you're not going in and colonizing it, which is another thing that I really would like people to be aware of. The goal of doing this work is to not come in and colonize and just put a flag on it and say, hey, like this is the best strategic area and I want to do this and I've claimed this and I'm going to just take charge and go at it without any awareness as to like what's going on around you. What are the policies already in place? How long has it taken to get into that work and to get the respect? Those are things that you listen by figuring out who's there, having a conversation heart to heart and being like, hey, I heard that you're a name that works in this space and I really want to respect and honor what you've done. And I would like the opportunity to really hear about what work you've done. And if it's okay after I hear about this, would you mind if I share what I'm working on? I want to really pair and partner with people who care, and you've shown that commitment. And I really want to respect your process and see if this is something that we can do in mutual consideration alongside each other. And so by being able to do that, you're making friends, they connect you with more people. So that way, when it comes into the public comment period where you only have 30 days, you've already made those connections. And potentially even with like the implementation measures for the language, you can also enact like, hey, these are these programs we're going to do for the outcomes. These are the people who have ownership over it, and different general plans can show, hey, this is an actual table of the implementation measure. Who has the ownership if this is current, ongoing, or if it's an 8-year or 6-year period, right? So there's ways to like incorporate also like the data and like using data scientists to really understand what's working, what isn't, bringing in the outcomes. So that way, when you are getting 6 years into the housing element and you're starting to prep for that 8-year revision cycle, you already have the systems in place for the assessment because you've paired with the right partners and you've thought ahead. And sometimes when local jurisdictions have no money, no resources, and there's just one planner working with past persons, making sure like if your organization saying, hey, we know that this is something that's required by law regarding the needs assessment and the inventory, and we really want to lift up support because this is such a huge lift, and I think it takes a community to make this happen. And so these are these ways in which we can help support you to have these outcomes, so that way you can show that you've done the requirements for the law, and hopefully you get more grant opportunities, because our goal is to support a rich and healthy and safe community as well. And so kind of a long addressing of what you're asking about, but it is a complicated, layered process, which really needs to, again, people need to be mindful of their implicit bias and what it looks like to come into space and to take up space versus being aware of who's in the room, who are the people that should be doing the talking, because those are typically the people that aren't saying much. And so really making space for them to be heard to and centered. And so again, that's usually, it should be like a 2 to 3 year process. And so I know that's a long-term thing, and a lot of people are dealing with grants that are on 3-year cycles. But if the first point you get your grant and you're at the first start of the first year, that's when you can do the reaching out. That's when you can interact with persons. And then that way, when you get to the very end of the revision cycle and the end of your grant funding cycle of that 3-year period, you can see measurable outcomes. And then hopefully there's pairings with universities who can go in and see, hey, what is the morbidity rate? What is like happening with these changes? How is this being measured for health outcomes? Because that information is what we use in model policies and laws to really support why we are enacting them. And that needs to be there, and that needs to be considered. So it's a really, again, it's a layered aspect. Really exciting, but I really do think that there's so much space for partnerships in with local community members enacting smoke-free multi-unit housing, but also like measurable outcomes and using the data. I also would like highlight, and I hope that Myrtle Beach in South Carolina, they just did an enactment of an entertainment overlay, but the Supreme Court case came down and said that they were correct in engaging in this entertainment overlay, which prohibited CBD shops, cannabis lounges, tobacco lounges, cigar lounges, any tobacco retailers were all prohibited in their entertainment overlay, which was their entire downtown in Myrtle Beach. And that's in South Carolina. And so what happens when we enact these policies is there should be this measurable distance as to like, what about health outcomes for the people who are there? Are the businesses that operate in those spaces? How do we look at that so that way we can use this as a basis to build more and more policies that reflect that focus that has happened in like, counties like Myrtle Beach or, communities like, and I'm going to go scroll back up to make sure, Tuolumne, like that, where they're able to like have these like impacted areas. So I really like what you're doing. Definitely would like to connect with you more. And I hope that answers your question. It was a very long.
Yeah, it really does. I just wondered one thing. Is it natural to assume that these people have been doing their work locally at the local level, coalition-wise, trying to set things up for legislation to just happen without the general plan? But then you say, hey, wait, we think it'll be good to put it in a model ordinance in the general plan. Why don't you jump on board? And are they going to be like, what? We've been doing this other stuff. Why should we join you on this general plan kick and then suddenly like have our work be on this general plan trajectory? Would that be offensive?
No, those are really good questions. That means they're thinking critically, right? Why would you do a standalone ordinance versus general plans? Well, with general plans, everything has to be consistent. Everything has to be comprehensive long-term. And typically you can see those policies, the action items, implementation measures, but then those are reflected and can be carried out in the zoning ordinance. And so for instance, like if they were to enact like a proximity or density restriction of no tobacco retailers, cannabis shops, or anything like that within 1,500 feet of schools, right? And they do that through, and they have a provision in their environmental justice or their health element or their land use element to say this, the centering of young adults and youth's health in our community is to take priority, right? Well, then, and their exposure to commercial tobacco products and tobacco product waste. And so that could be like potentially that policy, the overall policy. But when you go into the zoning ordinance, that's when you would see there's a restriction regarding that 1,500 feet, and that would be from like corner to corner, it would be measured. And so that's where that specific language would come in, but that language has to, again, be consistent with the entirety of the plan. So it can get complicated. And so, but for some communities, it's very hard to enact a standalone ordinance. And so what they will do is they'll look at doing it through zoning and general plans. I would also note with tobacco product waste, I don't see a lot of communities that really dig into the potential to do tobacco product waste regulatory policies. I see a lot of that opportunity in the conservation and open space and safety, like in other circulation regarding like wastewater, sewer, etc. And so the opportunities to address tobacco product waste, but also second and third hand smoke, as well as potentially like density due to health outcomes in specific communities that are disadvantaged as are defined by California statute. You have a lot of opportunity to deal with all of those areas in the general plan. With the standalone ordinance, you're really just looking at, like, for instance, like you can do one ordinance with smoke-free multi-unit housing or tobacco retailer licensing or outdoor air. Those are all great. And if your community is able to do that and you have the ability to propel that, awesome. I also think it's important, though, that the general plan is the city's document to plan for the future, and it also holds up the visions and the guiding principles of that jurisdiction. If you have an ordinance that has, smoke-free multi-unit housing or tobacco retailer licensing, great. But if you're seeing no mention of that in the general plan, I think that's a little bit of cause for alarm because it's on no one else's radar. And also potentially, like, what does that look like for enforcement when the city and the county aren't aware of these issues or these goals? You're more likely to have everyone on the same page working in concert when the vision and guiding principles reflect also in the ordinance reflect those. So again, the ordinance that's standalone does not have to be consistent with the general plan, but a zoning ordinance that is found in the general plan has to be consistent. I do think there's just a need, though, to really reflect what the community focus is. So that way there's, I guess, mutual agreement and understanding as to how they approach an issue or center an issue.
Thank you so much. I'm going to follow up with you later after this webinar. Thank you so much. I really got a lot out of this session.
Awesome. I'm glad. Does anyone else have any other questions or wanting examples? I would also note that, again, for the training that I would be working for, like a hands-on workshop, if you're able to fill out that survey, I know Sierra Club and a few other entities would really want to do this. And I'm a huge kinesthetic learner, which means I learn by doing. Which means if someone tells me, oh, you should go into general plans and do something, it's like, oh, but what does that look like? So sometimes by workshopping and bringing the thing that you're working on to really see how would other people do this? How would other people approach or consider this? And then what does that look like to have like some revisions and have your own mock public comment period and your own like mock document that you would submit for the public comment period? That can be very helpful. And so again, just making sure that you reflect on the surveys here, that would be super helpful, so that way we can see who's doing this work, who wants to do more of this work, who wants to get educated on how they would start doing this in their community as well, to really center what their scope of work is. But I'm going to mute while I look for anyone else to ask any questions. I just also, so there's two different surveys, and I'll just say this again. The first survey is to assess, did you learn anything about what I talked about? Was this helpful to you? Was there any, like, the implementation options or areas where you could see this in writing or commercial tobacco regulatory work? Those examples, were they helpful to really give you insight to start going into this area or considering this area of work? And then again, the survey training one is again focusing on us, PHLC, in conjunction with a few other entities, such as Rise or Sierra Club, would be hosting a regional training. It would be in person. There would be some preliminary Zoom mandatory periods that people would have to go to in order for preparation to really center equity and understanding of like racialized context of this past work and how it has harmed certain communities in the past and why people need to be aware and center it. But then the in-person workshop would be people would bring their element, or if they wanted to submit on a vision or guiding principle, but they would bring that and then it would be reviewed and you would get that hands-on training in the space of 2 days in person of like, how do you review it? What are the things you need to focus on? What are like presentation of format methods? And then hopefully pairing with people who do this work in the field, who do the community engagement and advocacy in the public comment period. And there are really great organizations and people who presented on the CTPP call that really are focused in that area. And it would be great to have the incorporation of potentially other partners to really just give like a full experience as like, this is your like mock public comment, and this is your mock document that you're presenting. So that way people like go through the entire experience within the course of 2 days. So it'd be very intensive, but it'd be very informative. And so really just looking to see who has interest of this when putting this opportunity out there and going into the intensive planning aspect to make it happen and have it become reality. So those are the 2 surveys, but does anyone have any other further questions? I know this has been an hour and a half and I'm very grateful that you all have hung in here so long. Well, I'm not seeing any, like, and I know sometimes information takes some time to percolate. So if anyone just wants the information to sit for a bit and really process it, that is okay too, but feel free to reach out to me later with things that you thought of or insights or ideas where you had like a moment you're like, oh, I really connected with that. And how would I bring this into my scope of work? Feel free to reach out to me. Stephanie Lackey was great enough to put my email in the chat. It's rachel.chambers@mitchellhamlin.edu. I'm welcome to have any conversations with people. I do think the meeting of the minds can bring about really brilliant ideas in the creation of really awesome areas to help impact health equity and also benefit communities. So thank you for all your time and thank you for attending. I hope you have a good rest of your Thursday.